best practices in feeding in the first 1,000 days. A very important thing to understand and absorb for everyone, because what we are of the species called Homo sapiens, Homo sapiens literally translated would mean wise man. So are we all wise regarding the best practices in feeding our young ones, or do we need to know or revise what we already know? So the first 1,000 days refer to the period from the moment of conception. Any nutrition of a child or any care or the holistic care, as we say, starts from the womb. The mother conceives at that point of time and continues till the second birthday is achieved. So it's the first 1,000 days which refer to the period of conception to the child aged 24 months. Why are they so important? When we say first 1,000 days, we need to understand that the first 1,000 days are a period of rapid growth. During pregnancy, those 9 to 10 months, rapid growth, absolutely, from a zero, a single cell, to a whole human baby. Then again, the period of breastfeeding is very important. It is a period of rapid growth. The child needs nutrition. And then comes weaning, when we switch over to solid food and the toddler's food. So, in summing up, it is important because what you do, what you eat or experience during the first 1,000 days has a lifelong consequence on your health. When the child is little, there are so many miracles happening in the child's body all the time. So when we talk about miracles or significant developments, we need to understand that the child's brain is maturing, the cognitive development is occurring. Simultaneously, he is growing brain and brawn, and simultaneously, there is an immune maturation occurring. The metabolic organs are actually maturing, and the digestive system, about which Dr. Shilpa was speaking, is maturing as well. So what happens to the physical growth? One cell at conception gives rise to 500 trillion cells by 3 years of age. Triples the birth weight in the first 1 year, and growth more in the first 3 years than in all life taken together. Cognitive development, as I said, why is it so important? Every mother wants her child to be first in the class, get 99.99%. But remember, for that, you have to understand the significance of the first 1,000 days of life. 80% of adult brain mass is achieved by 3 years. And in the first 3 years, there's a 3-time increase in the weight of the brain. Not only that, you will be surprised to know that the child learns about 900 words by the time he is 3 years old. Talking about the immune maturation, it takes about 2 years to develop the body's most potent immune organism, the gut barrier. So the gut has around 1 kilo of microorganisms in it, and they crosstalk with the gut, and there is something which is referred to as the brain-gut axis. So important again, the maturation of the gut barrier. Early life colonization is crucial, and that depends on the mode of delivery, on the nutrition, whether the child is breastfed, whether the child is given complementary feeding on time, whether the child is given cow's milk, whether the child has been delivered by LSCS, or whether the child has a normal delivery. All these will in fact affect the immune maturation. Digestive system, again, as you all know, that the child is born with an immature gut, and the digestive and the absorptive capacity gradually develops in the early years. हम लोग पहले माँ के दूध से शुरू करते हैं और gradually हम लोग उसको wean करके complementary diet पे लाते हैं. So the immature gut gradually matures and learns to accept the food that the Homo sapiens take. ये वाला हिस्सा जो हमने रेड मार्किंग में किया हुआ है, ये इंपॉर्टेंट एरिया है, where from the period of conception to 2 years of age, you can see the yellow line, how rapidly the child grows, and thereafter there's a plateau, and finally, again, as the child matures to 2 years plus, it gradually starts decreasing the rate, and again it goes. When the child is a teenager, again there's a rapid spurt of growth. So these are the two periods when the child actually needs a lot of nutrition support, once in the newborn period and once in the teenage period. The impact is very, very critical. You will have to understand that if the child has, in the initial months of conception and at birth, till the weaning, if the child has optimal feeding, the child will have optimal growth and develop into a healthy adult. However, if there is alteration or if there is deprivation, the child will grow into a diseased adult. So the end, हम बोलते हैं हमारे माँ बाप ने दिया, हमारे माँ बाप ने दिया. I've shown here, ये जो yellow portion है, just 20% of what we have is genetic, and rest of it, पूरा 80% of disease risk in the life is due to the environment, due to the nutrition, due to the lifestyle. तो 20% खाली होता है inherited genes जो हमें disease दे सकते हैं, but rest of it is in our hands. So nutrition, lifestyle, environment is in our hands. एक being effect बोलते हैं हम लोग, सभी ने bees को देखा होगा, मधुमक्खी को. So what happens is, यहाँ पे मैंने worker bees दिखाई हैं, जिनको 3 दिन के लिए इनको अच्छी वाली जेली मिलती है, और यहाँ पे मैंने क्वीन बी को दिखाया है, जिसको 3 दिन की जगह डबल द डेज, 6 दिन को इनको अच्छी वाली जेली मिलती है. So what happens is that worker bees have worker like behaviors. 6 हफ्ते में ये लोग मर जाते हैं, और when the queen bee later on lives for around 4 years, is larger in size and the behavior is totally different. तो आप worker bee का 3 दिन का खाना और queen bee का 6 दिन का खाना इतना difference एक ला देता है. So in the human being, when we see this, we call it a being effect. Pregnancy nutrition, I think Dr. Richa will talk about this in detail, तो मैं बहुत ज्यादा नहीं बोलूंगी. Nutritional status of a woman before pregnancy is important. क्यों? क्योंकि अगर वो माँ बनती है उससे पहले वो कमजोर होती है, तो कंसेप्शन पे और कमजोर होगी, बर्थ पे कमजोर बच्चा पैदा करेगी, प्रीमेच्योर प्रीटर्म बच्चा पैदा करेगी. जैसे कि डॉक्टर धीमन वाज सेइंग दैट द मेजर कॉज इज प्रीटर्म एंड इन्फेक्शन इन आवर कंट्री. सो प्रीटर्म अगर बच्चा पैदा करेगी तो आज नहीं कल नहीं, it will have a genetic effect, epigenetic effect, and for ages to come हमारे generations कमजोर होते जाएंगे. So लड़की का, बेटी का न्यूट्रिशन, ensure that she has good nutrition. अगर मदर अंडरवेट है, अगर मदर ओवरवेट है, दोनों ही स्थिति में it will be a health risk for the child. So nutritional requirements कुछ चीजों की बढ़ जाती हैं प्रेगनेंसी में. टोटल फूड इनटेक जो है वो इतना नहीं बढ़ता. सो हम कहते हैं ना 2 का खाना खा रही है, नहीं, क्वालिटी ऑफ फूड मैटर्स मोर than the quantity of food. So maternal nutrition and breastfeeding are interlinked, because breastfeeding woman के requirements जब तक पूरे नहीं होंगे, milk secretion अच्छा नहीं होगा, she will have a lot of problems in feeding their children. And because a lot of vitamin levels in breast milk are linked to dietary intake in the mother, again we need to be very, very careful about the mother's diet. So since I'm talking about best practices, the first best practice that I will emphasize upon is promote and support good maternal nutrition during pregnancy. Dr. Richa will enhance on this. So while you are talking about good maternal nutrition, you must remember that education on optimal nutrition for exclusive breastfeeding is important. तो सिर्फ वो खाना ही नहीं खाएगी, उसको उपयोगिताएं भी बतानी है, इसको impress upon करना है, educate करना है why it is important to have good nutrition for exclusive breastfeeding. Again, who does it? You and me. We are health providers, we are community workers, we are providing these education. And सिर्फ माँ को ही नहीं, remember education of the father, education of the family, और खासकर हमारी society में education of सासू माँ is very very important to have good nutrition for a pregnant or a lactating mother. Breastfeeding is the best way to feed a child, and today we know कि पोषण में बेस्ट आहार क्या है? बेस्ट आहार है खाना बच्चे का, ब्रेस्ट फीडिंग इनिशियली इन द फर्स्ट 6 months. तो हमें एक्सक्लूसिव ब्रेस्ट फीडिंग करनी है और हमें और कोई भी चीज नहीं देनी है. कई लोग जन्म घुट्टी देते हैं, नो जन्म घुट्टी. कई लोग हनी देते हैं, नो हनी. सो ब्रेस्ट फीडिंग एक्सक्लूसिवली इज द फर्स्ट बेस्ट प्रैक्टिस. शॉर्ट टर्म बेनिफिट्स होते हैं, कुछ लॉन्ग टर्म बेनिफिट्स होते हैं. शॉर्ट टर्म बेनिफिट्स हैं ब्रेस्ट फीडिंग के, दैट इट प्रोटेक्ट्स अगेंस्ट एनी काइंड ऑफ इन्फेक्शन. इट इज द फर्स्ट वैक्सीन फॉर द चाइल्ड इन फैक्ट. लॉन्गर टर्म बेनिफिट्स में बहुत सारी चीजें हैं. ऐसे बच्चे जो एक्सक्लूसिवली ब्रेस्ट फीड करते हैं, it has been seen that it is associated with a lower incidence of obesity, a lower incidence of diabetes, and a lower incidence of blood pressure and cholesterol. Now, higher performance in intelligence tests. Yes, many studies have shown. Devin, will you close the door? So many of them have shown that in the intelligence, the IQ levels are about 5% greater in these children. ह्यूमन मिल्क में आप देखो ना, बड़ा यूनिक सा कॉम्पोजिशन होता है. कोलेस्ट्रम पहले आता है, उसके बाद ट्रांजिशनल मिल्क, मैच्योर मिल्क, प्रीटर्म मिल्क, फोर मिल्क एंड देन हाइंड मिल्क. Each of these types of milk have a unique type of a constitution. Then will you please close the door? The न्यूट्रिशन कंपोनेंट्स भी आप देखिए. अगर आप देख रहे हैं स्पाई डायग्राम में, तो यू विल फाइंड दैट देयर आर फैट्स, प्रीबायोटिक्स, प्रोटीन्स एंड लैक्टोज. सबसे ज्यादा लैक्टोज है, प्रोटीन्स है, प्रीबायोटिक्स है एंड फैट्स है. सो एक मेजर पोर्शन is actually beneficial bacteria as well. So this again depends on आपका कैसा वाला डिलीवरी है, कैसा वाला न्यूट्रिशन है. So again remember that very important is the mode of delivery, very important is the mode of nutrition. So colostrum again, एक चम्मच भी बच्चे को मिलता है तो it is adequate nutrition for the baby. Now the best practice is, कई माएं सोचती हैं कि हम ना पिलाएं तो हम बहुत अच्छे रहेंगे, स्लिम रहेंगे. So motivate the mother even before birth to feed the child. आप उसको बार बार समझाएं what are the benefits for her, what are the benefits for the baby, and motivate the mother before the birth. बाद में करने से उतना इफेक्ट नहीं मिलेगा. Select the right place for delivery. आजकल we are stressing upon institutional delivery. So the best practice is institutional delivery. Avoid unnecessary use of drugs and other things. कई माओं को मैंने देखा है वो कोक ही पिए जा रही हैं ड्यूरिंग द. मुझे अच्छा लगता है प्रेगनेंसी के टाइम पे कि मैं कोक पीऊं, तो वो बोतल बोतल कोक पी रही हैं, but that is not very good for the baby. So avoid unnecessary toxic things and soon after initiate breastfeeding soon after delivery. 1 घंटे के अंदर बच्चा इस लायक हो जाता है कि वो ब्रेस्ट फीडिंग ले, तो बच्चे को माँ के छाती पर लिटा दे and let the child root for the breast and accept breastfeeding within 1 hour of birth. Go for colostrum and avoid any कि ननद आएगी, काला टीका लगाएगी, फिर वो शहद चखाएगी. Avoid any prelacteal feeds and maintain a good position for suckling in the baby. I will demonstrate and explain this later on. So recommend ये करते हैं हम कि आप बार बार ना पिला के, बेबी जब डिमांड फीडिंग करे, जब मांगे, तब बेबी को दूध दे और भरपूर दूध वो लेगा उस वक्त और उसके बाद वो रेस्ट करेगा. So as long as the baby wants, you feed the child. And बार बार निपल धोने की जरूरत नहीं है, बार बार सफाई करने की जरूरत नहीं है. अगर माँ नहीं पिलाएगी, माँ को caution करिए that there may be breast engorgement. So the best practice is that the baby should actually be taking demand feeding and with correct attachment and correct latching. So correct attachment, when I say, if you can see me over here, this is exactly how you should be holding the baby in a straight line with your hands supporting the baby turned towards the mother's chest, the abdomen of the baby at the epigastrium of the mother and touching the mother. So baby को उठाना है, आपको नहीं झुक जाना है baby की तरफ. So remember that the baby should be towards the mother, not straight. बच्चे की गर्दन नहीं घुमानी है, बच्चे को पूरा पूरा घुमाना है. करेक्ट लैच अगर नहीं होगा तो व्हाट विल हैपन, मदर के निपल में सोरनेस होगी, मदर का निपल क्रैक करेगा, मदर विल नॉट बी एबल टू फीड द बेबी. सो व्हाट आर द साइंस ऑफ करेक्ट लैच? द बेबीज माउथ शुड बी वाइड ओपन. निपल सकिंग नहीं करनी है. यू हैव टू हैव द एरियोला and the nipple inside the mouth of the baby. नीचे का एरियोला पूरा, ऊपर का एरियोला almost all. And उसके बाद बेबी की थोड़ी chin should be touching the breast of the mother. So remember, nose should be free, chin should be touching, the mouth should be open, and the areola should be in the mouth. So if you are actually correct latching the child, then there will be no problem in feeding or giving the child breast milk. Kabhi kabhi problem aati hai. There are inverted nipples. So when I was an intern, what we used to do is that हम पहले से माँ को mentally तो prepare करते थे, but we used to respond by asking her, हाथ में थोड़ा सा घी ले लीजिए और रोल करिए, अगर बहुत फ्लैट है तो जब तक बेबी डिलीवर होगा इट विल बी प्रिपेयर्ड. उसके बाद हम लोगों ने शुरू किया, सिरिंज को काट करके उल्टी तरफ उसका पिस्टन लगा देते थे और माँ को चोट न लगे इसलिए माँ के ब्रेस्ट में एक पिस्टन को लगा करके उससे वैक्यूम क्रिएट करते थे, ताकि धीरे 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 करते करते जब तक डिलीवरी हो तब तक माँ के इन्वर्टेड निपल्स करेक्ट हो जाए. Another correct practice is burping the child after feed. Each meal the child needs to burp and take out the extra air that the child has had. कई माएँ will complain, बच्चे को कोलिक होता है, बच्चा complain करता है, बच्चा बहुत रोता है. Remember always that if the child is not burped properly, then there is a प्रॉब्लम विद द चाइल्ड. धीरे धीरे कंधे पे आप सहला सकते हैं या आप बिठा के बच्चे को सहला सकते हैं, और अगर उससे भी नहीं होता है, द प्रैक्टिस वुड बी टू पुट द चाइल्ड ऑन हिज टमी. 5-7 मिनट में ही उसका एयर इरेक्टेशन हो जाएगा, और उसके बाद आप बेबी को यू कैन फ्लिप द चाइल्ड ओवर. Remember always that breast milk, if you are working mothers, you have a problem, the best practice still remains to give breast milk. तो तब आप क्या करिएगा? You can give expressed breast milk, and this breast milk, please remember, आप सोचते हो बाहर खराब हो जाएगा, but if it put in a deep freezer, 3 से 12 महीने तक ये मिल्क स्टोर हो सकता है. बाहर भी छोड़ देंगे तो भी expressed breast milk can remain at room temperature for about 6 hours. तो अगर आप expressed breast milk देना चाहते हैं तो वो भी कर सकते हैं. And if you have a lot of milk, I will advise you to give it to the milk bank. KGMU has already started a breast milk bank which helps all mothers who cannot give breast milk to their children. Weaning becomes very, very important at the correct time, at the correct space, in the correct amount. So 2 key reasons why we need to supplement and complement the breastfeeding is, आपने 6 महीने तक exclusive दिया, 6 महीने पे those who are Hindus will remember we have a Annaprashan ceremony. So our old wise men knew that we need to give the child some complementary feed at 6 months. Even in the Quran, it is written that the child must be given complementary feed at 6 months. So those wise people have told us the correct age of weaning. And remember, it is always done with kheer or chawal. So we all know that Rice never causes any problem, but wheat may cause an allergy if the child is not acclimatized. So starting weaning is always with fruit and rice. So each food should be given to the child. सब मिला के गबड़ के मिक्सी करके नहीं देना है. You have to give each food one at a time so the child acquires new tastes. Those children who are introduced to solid food by 8 months of age, the child will develop a chewing reflex और तब वो अच्छे से खाएगा. मिक्सी करके देंगे, remember the child will not recognize textures, the child will not recognize the feel, the child will not develop a healthy eating habit. फिर आप 5 साल तक मिक्सी किया हुआ खाना ही देते रह जाओगे. ये feed habits, ये conversion to weaning is also linked to the cognitive development in the child. वो बच्चा जब उस फल को पकड़ता है तो उसका साइज, उसका स्पेशल अरेंजमेंट, उसका कलर, उसका फील, टेक्सचर सब समझता है. सो जो बच्चे को आप उसको नहीं फील करने दोगे, that child will become a fussy eater later on in life. So remember that I have shown here in the blue portion per kg body weight compared to adults. The child needs 5.5% more times more of iron, 4 times more of calcium, 3 times more of essential fatty acids. So basically the young people have specific and greater requirements. अब हम लोग करते क्या हैं कि काम खत्म करने के लिए 2 मिनट में मैगी दे देते हैं, ये सब दे देते हैं. सो रिमेंबर, नो जंक्स एट ऑल. If the toddlers do these days who are eating too much protein, they are at risk of obesity. They are taking too much salt and they are at risk of blood pressure by the age of 20. Too much saturated fatty acids, again heart disease later on, and too much sugars. Remember, सब बच्चों के आजकल dental caries हो रहे हैं, दांत खराब हो रहा है. Not enough vitamin D again you have a lot of rickets and problems with all these things. So nutritional status becomes very, very important. So the second best practice is infant and young child care के जो भी चीजें होती हैं, follow the guidelines and care practices. Breastfeeding at 1 hour, engagement of the fathers and the family. Weaning started at 6 months and continue breastfeeding till the age of 2 years. Again, as you support them, there are ancillary things which you must look at. Integration of this with the safe drinking water. आधे से ज़्यादा nutritional problems arise from unsafe hand washing, unsafe excreta disposal, unsafe food hygiene. So you must look after the wash practices also. And we have so many supplementation and fortification programs which you must also tell the baby and the mother about, but tell the mother and the family about. Remember, another very good practice is keeping the baby warm. Temperature has to be maintained at all costs. And what have we really learned? We have learned this from the kangaroo. We call it the kangaroo mother care. अगर आप लोगों को, I don't know how many of you know, but कंगारू का बच्चा कुछ इंचेस का पैदा होता है, premature पैदा होता है, and it spends around 3 months in the kangaroo's pouch and gradually goes to a big size kangaroo. So skin to skin care, maintaining the temperature again is a birthright of this child. And skin to skin container, जब आप temperature maintain करेंगे, the child will have so many ancillary benefits. He can root for his food mother के nipple पर. He can actually gaze at his mother and feel comfort and support. So at risk बच्चा भी होता है, he is mentally stress free because he is with the mother in a skin to skin touch. So this is another best practice that you can give. So health and nutrition do not stop at just the baby's initial care, but you need to make nutritional assessments. You need to counsel the mother even after the first 24 months. So each time that you meet the child on a vaccination spree, you talk to the child and the mother and you counsel, you assess the child, you talk to the mother and you tell her what is there more that she can do good for the child. You address her concerns. So that again helps. Half of the mothers come to us and say, मेरा बच्चा ठीक से दूध नहीं पीता है, बढ़ नहीं रहा है. So there again, you have to check कि सच में या एक्चुअली असेस करने के बाद आपको लगता है नहीं, द हेल्थ पैटर्न इज ऑल राइट. सो द हेल्थ पैटर्न इज ऑल राइट, यू नीड टू काउंसिल द मदर, रीअश्योर द मदर. सो अमंग्स द कम्युनिटी थिंग्स दैट वी डू, आज हम जो कर रहे हैं, वी आर एक्चुअली स्प्रेडिंग कम्युनिकेशन टू ऑल ऑफ यू, एंड आई होप दैट एवरीबडी will counsel and help the mothers. And the concluding thing that I need to say is that the first 1,000 days offer a unique window of opportunity. Do not miss it, because it's a period of rapid growth, and therefore it is crucial to ensure that every mother and child have access to optimal nutrition in the first 1,000 days. Thank you so much.